Welcome, everyone. We'll take a couple of minutes for everyone to log in and get settled. You're at this session for Holding Space for Grief and Healing in the Workplace, AAPI listening sessions. We have some wonderful speakers, Rochelle Espiritu and Annie Van Dan. We'll just give a moment for everyone to join. Thank you for joining us, Jessica, Jose, Bridget. Just want to let everybody know that the slides will be available following this, and then the presentation, and we'll have the slides in the chat as well. Thank you, Rochelle. Rochelle has placed the slides in the chat box. Hi, Christina. Representing Sacramento. Good to see everyone joining us. We'll give everyone a moment to sign on, get their audios. I'd like to remind everyone that your microphones are off, but this session will be recorded. Can we advance to the next slide? We'll go ahead and get started here. I'd like to just acknowledge that this training is offered through the Crisis and Recovery Enhancement Care TA Center, which is funded by the California Department of Health Care Services, DHCS, and administered by the Center for Applied Research Solutions, CARS. Disclaimer, the views, opinions, and content expressed in this presentation do not necessarily reflect those of our funder, the California Department of Healthcare Services, or our Care TA Center partner agencies listed below. In the case of any security issues that may occur, this session will immediately end and will not resume. A separate email will be sent out to all participants with further instructions. Thank you all. Thank you, Stephanie, for joining us. M. Garcia, thank you all. Just like to take a moment to share some need to know and community agreements. As I said in the beginning, all the videos have been turned off. You are available to participate and engage with emojis, hearts, clapping, thumbs up, and then you're also able to ask questions to our speaker in the chat box. So we'll be holding the questions towards the end, but you're able to ask questions throughout the presentation. We'll just hold the questions to the end and then allow the speakers to have a moment to respond to questions towards the end. Please use I statements in the chat and avoid making comments that are stigmatizing or otherwise injurious towards others. If you don't want to engage in the chat feature, you can minimize the chat box. You can also select speaker view to enlarge the video speaker and remove most participant videos from view. If you experience any tech challenges, a CVent tech host is available to support. You may message them in the chat box. And in our community agreements, please be kind and courteous. Listen attentively with an open mind and open heart. Share the space, expect and accept a lack of closure. We won't get to everything, but we'll get to as much as possible. If informed that our comment or behavior is stigmatizing or injurious, we will acknowledge and apologize. Can you advance to the next slide? And at this moment, we would like to jump into our presentation. And I would like to introduce Rochelle Espiritu and Annie Van Dan to introduce themselves and to begin their presentation. Thank you.
Thank you, Terrell, and thank you to our hosts for today's workshop. We're really excited to be here with you today. My name is Rochelle Espiritu. My pronouns are she, her. And I am a founding partner of Change Matrix, which is a small women-owned, minority-owned business. And we partner quite a bit with CARS on different activities. And so we were pleased to be asked to share some information with you today about some of our workshops and listening sessions that we've been conducting. My background is in clinical psychology, and I'm a first-generation immigrant from the Philippines. I was born there and came here to the States when I was a toddler, and I'm based in Denver. I will pass it on to Annie to introduce herself.
Hi, everyone. Thank you for being here. I am Annie Van Dan. I am Chinese, Taiwanese American, and I am a change specialist for Change Matrix. So really neat that Rochelle and I get to work together through Change Matrix, but I'm also in Denver, so based here and really active in the Asian American community locally as well. And my background is in public health. I worked for the state public health department in health equity programming before joining Change Matrix. So like Rochelle said, we're excited to share with you some of the work we've been doing to support the AAPI community through these listening sessions, and hope that you're able to gain some ideas and strategies for practices you can be doing at your workplace.
Thank you, Annie. So I'll just go over the objectives that we have for our session today. So we're hoping to share with you some ideas, some practices that we've been implementing that are responsive to the racial traumas that racially and culturally diverse employees are experiencing, both inside the workplace and outside of work within their own communities. We're doing this within the context really of rising hate crimes that are occurring, the racial injustices that have been happening, especially after George Floyd's death, and many more. And so we know that our workforce is hurting right now, and we wanted to be able to create some spaces for people to heal, which is our second objective, is to share some of what we've learned along the way. We've been conducting listening sessions through TA centers as well as within our community across the nation. And so we've learned a bit from listening and hearing from different, both Asian American and Pacific Islander participants, allies, and thought a bit about how we structure them and process them. And so then we do hope that you can learn some ways that you might implement listening sessions in your own organization to support your diverse workforce. So this is an emotion wheel. I hope that you can see it okay on your screens. But we wanted to share a tool with you that we use in our listening sessions and healing circles, as well as a way to enter into the space. So wanted to share this tool with you. And I invite you to take a look at the emotions. You can see kind of the broad ones in the center, and then they kind of expand out into other emotions or feelings that you might find along that line. So we invite you to take a look at that, and then think about the emotion or feeling that you're coming into this space right now. And also wanted to note that we welcome all emotions, and that's how we always come into listening circles and or healing circles, is that every emotion is a valid emotion. So I'll let you take a look at that. And then when you're ready, if you could share that in the chat, we would like to learn about how you're feeling coming into this space. And I will start by sharing that I am feeling right now courageous. And we heard that Y Kimura is feeling curious. Stephanie is feeling anxious. valued and curious. And yes, if you have more than one feeling coming into this space, feel free to share that as well. Yeah, vulnerable, tired, but hopeful and inspired, busy. Yeah. Lots of different emotions that were each coming in, and noting that sometimes our feelings are a bit dichotomous, and that's like, okay, we can be in those spaces at the same time. So feeling both trusting and guilty. So lots of different emotions that that we think are really important to acknowledge and to verbalize and share and to be noticed. So thank you very much for sharing. We'll go on, and just wanted to share a quote from one of the listening sessions that we provided last month. So the quote is, "Listen, just listen. Try to understand something that is new and unlike the way you've heard it before." And I think what that kind of highlights for us is this, the power of listening, the power of extending that space to a colleague or a friend or a family member. It's super powerful, and it allows people to be heard, to be seen, and to be validated. So we have definitely found these listening sessions to both be a space of healing for participants, as well as very powerful spaces too, where you can hear new ideas or new ways of being, and or just connect with someone else who might be experiencing something similar to you. So we wanted to just provide a little bit of a context for how these started for our organization. So when, as you all know, the pandemic has really increased kind of different thinking and ways of thinking about the Asian American and Pacific Islander community. Many of this was spurred by the previous administration, when the coronavirus was referred to as the Chinese flu, and other terms. And so what we've seen is a real increase in violent attacks and hate crimes against the AAPI community. And the thing to note that many of you probably know is that these attacks are not new, that they have been happening in our country for decades. And yet there was a little bit more media attention that was occurring. And that was really heightened in March, when there was a mass shooting in Atlanta that killed 8 people, and 6 of whom were Asian women. And I will share that after that event, we quickly realized that we needed to support the community. I was getting calls from colleagues and from other members across the country around the intense emotions that people were feeling in response to this, as well as some feelings of isolation. And so we wanted to make sure that we were standing up as a center. The Mental Health Technology Transfer Center, or MHTTC, is a federally funded center by SAMHSA, the Substance Abuse and Mental Health Services Administration. And we're charged with providing support to mental health providers in the region, which includes California. And so we held 2 listening sessions for AAPI behavioral health providers and their organizational staff as well. And so what we're going to be sharing today are some lessons learned from that experience, as well as follow-up listening sessions that we ended up hosting, because we did have some regions who reached out to us after these sessions and said, could you do one specifically for our county or our regional area, which had a collaborative of different AAPI serving organizations. So we'll share those lessons learned and the process that we used with them. So why did we really feel that this space was important? Well, we heard from people that not everyone always had the space to share or to connect or to support. And so especially for AAPI providers who may have been one of a few or a handful of AAPI identifying workers in their community organizations or agencies. And so we wanted to just have this space for people to process what they were experiencing, really to hear from others, because often that hearing from others makes you know that you're not alone. And to find ways of being from each other or for yourself during a time where a lot of people were feeling some extreme grief, loss, anxiety, and fear. And so we wanted to make sure we could create this space for community to be supportive for each other. So I will pass it over now, I think, to Annie to talk a little bit more about how we went about doing this.
Thanks, Rochelle. So as Rochelle was saying, for you, I would like you all to even just kind of take a moment to bring yourself back to, I think, March, when the shooting in Atlanta, I think, really shifted a lot of how APIs were feeling. There was really kind of this like racial self-awakening, where for many of us, we just started thinking about all of the racial experiences we've had in our life and what those meant. And so just for you to even think about how many API staff do you have or colleagues do you have, and what Rochelle was saying, some organizations, or if people were feeling very isolated, like being maybe the one or two only API that are in their workplace. And we were hearing a lot about how people needed the space to come together as AAPI, a safe space, and also to really just grieve together, and then allies really wanting to help and support their colleagues. So this welcoming space, this was some of the language that we used. So we are in this space and time when the ongoing pandemics of racism, COVID-19, and health inequity have come together and put the world at a vital turning point. Again, we're talking about the rising racist attacks. I think what was happening was that there were a lot of there was more and more media covering the racist attacks that were happening nationwide. But seeing the Atlanta event, I think, just changed everything. It just was such an emotional time to be AAPI. So we must stand together with our AAPI colleagues, and you're holding feelings about these events as well as responding to the feelings of the clients and students you serve. So specifically for AAPI providers, it was an extra layer, because they had to also support the clients in their community as well. So one of the practices we did with just registration when we were promoting the event, the listening sessions. So one is that we really promoted it for API providers. And actually after the first session, there were so many attendees that were more allies. They did not identify as API. So that was a learning as far as adding additional registration questions to identify your racial identity, so that we could get a sense of who are API versus allies. Also asking for your role in the organization, so that we could be more intentional about when we did breakouts, to be careful around like supervisor versus supervisee relationships, like people who are coming from the same organization, and being sure that they felt comfortable to share. Also that sometimes it felt like allies were just wanting to speak and share kind of how they were feeling, and sometimes it would be taking away from the staff or the individuals that were actually experiencing the racial trauma. So we were able to be more intentional as far as like creating breakout rooms where we had some that were just for allies, and then some that were specifically for AAPI. Rochelle was just sharing that this morning she was also in a session where it was for all of the API staff, and that the session was then live streamed for allies to be able to hear and learn. So just different ways to kind of think about how to set these listening sessions up, so that it really is a space for the staff or the community that is most affected. So other parts of the process. So again, we talked about just the welcoming space and identifying if people were allies. So we can consider like the makeup of the small group sessions. So we really didn't want it to be where you had maybe, again, like 1 or 2 API providers and then everyone else was allies in the group. So being intentional about that, so that we could center the API voice, again, separating supervisors from supervisees. And then we also created space for safety. So offered a calm room so that individuals could leave the discussion and offer support. So what we noticed was that most people, like no one ever actually used the calm room, but that it was because also we promoted that space as it wasn't necessarily a therapy session, but that we could offer resources and just a way for people to step away or to turn off their camera. So just wanting to kind of offer that space with each session. We also had a wellness space so that at the end of the session, we did some kind of exercises and offered an opportunity to reset after having a heavy discussion. We also set group agreements so that the space welcomed all emotions. What Rochelle was saying, starting with like that emotion feeling wheel, and that we wanted to practice gracious listening, that we wanted to have the space be contextual confidentiality. So who said what stays in the session, and then centering the API experience and extending grace. So those were some of the group agreements that we came into the conversations with. So here is just some of the quotes that we pulled out from those sessions. So individuals saying, I am disappointed. When BLM started, I checked in with my friends. Now no one is checking in on me. And so one of the things we really heard was just the power and the, just feeling supported with just a simple check-in. Just how are you doing? I think it is hard to just go about our work and just be expected to continue working when something like this is happening in your community and really impacting you as an individual and your families. Like so much of what we heard was just the amount of fear that people were feeling, like the worry that they were carrying, like thinking about these incidents happening to their parents or their loved ones. So it's heartbreaking and painful to hear about individuals and families that don't feel safe going out. And a lot of people were just saying like all they could see was like their own parents or their own family members, when they were seeing others being attacked. And then there's so much to tackle and it's hard to know where to start. So similar to some of you who shared in the beginning, just kind of that feeling of, anxiousness and busy, like there's so much to do around this work. So we wanted to ask you all if you could share in the chat if there's been any mindfulness kind of related activities that you've participated in at your workplace. We know that this is becoming a more common exercise that there could be opportunity to learn from each other as well. I'm not sure if any of you have participated in any listening sessions and would welcome you to share what your experiences have been or any healing circles.
And Annie, as we're waiting for people to respond, I'll just share that one of the things we talk about often is what you were talking about from that first quote, like the participant sharing that no one had connected with them. And in kind of the trauma-informed world, one of the phrases that we use often is to connect before you direct. So to remember to connect with your colleagues on, in a little separate, different way from work, recognizing that our relationships are so central and important to the kind of work that we do in the mental health system. And so that's one thing we're always encouraging people in organizations to think about, like, how do you connect, how do you build that into your meeting space or your meetings in general, so that people have those opportunities in a regular and consistent way. But would love if anyone would like to share anything in the chat about maybe a mindfulness activity that you've done in the workspace. It might have been like intentional breathing at the beginning of a meeting, or some workplaces are offering other types of wellness activities like morning yoga or, doing an afternoon coffee chat, things like that, is a little bit harder to do in this time of COVID. And it does force us to be a little bit more intentional. So, Annie, there are a couple comments in the chat if you want to.
Yeah, and I'll just say I've been on
those.
some too where they're just playing kind of like relaxing or tranquil music and just doing kind of simple things like that, especially because we are really in this virtual space now. So so Bridget, I think as an API, says like this is her first time in a listening session, and she connected with that statement about not being checked in on. The hate crimes against APIs have never been mentioned at my workplace. So, so just what Rochelle was saying, just we have really been hearing just how meaningful it is. Just even when somebody asks you, just how are you doing? I've seen what's happening. I'm here. I support you. And, I've had a lot of AAPI colleagues say a similar experience, that it's very hard to just have to go about our work and feeling like nobody really understands. And especially if there are no other, people like you, so not just API, but, when other communities have experienced this kind of trauma and you feeling like you're kind of just carrying that weight on your own. And just even when one person asks you just how meaningful that is. And specifically around this incident, there were so many individuals that just talked about just breaking down, emotionally when someone would check in with you. Just how meaningful that was, like how much that meant to you to just be like, okay, somebody sees me, somebody sees the experience of my community. Thank you for sharing. And then Jessica, I am part of an Asian American meditation group that meets once a week on my own time. And then at work, we serve Native Hawaiian students, and we have regular opening Pele prayer each day that we can join on Zoom. That's really wonderful.
And it looks like there's somebody who shared they end staff meetings with guided meditation that has gotten a lot of positive feedback. That's great. Thank you for sharing.
Yeah, and it's great to hear that there are different activities that your workplaces are doing, and then also that there's opportunities for you to engage with your community outside of work.
Yeah, and Annie, I just wanted to add too, like for those of you who maybe don't have any of these opportunities in the workplace, what would it look like to suggest one, or to start one, or to find one, right? And I will share that not every organization has the culture of wellness integrated into their processes or ways of being. And I was just on a listening session this morning that Annie mentioned, and one person stepped into their listserv space and just, after the Atlanta tragedies happened, just shared how he was feeling. And just doing that one step, opened up so much communication for others to step in and to share how they were feeling too, and to make connections. And sometimes it does take a brave step, to go into that space and put yourself out there. And it's hard. And what it did was transformational for this team, and that then they ended up having listening sessions that they've been doing and other things to engage both team members as well as their leadership in noting what kind of had to be done to support team members.
Mm-hmm. Michelle, thanks everyone for putting your comments into the chat. So we're also seeing Christina shared weekly check-in as a small group, but was challenging because most folks who identified it as API initiated those conversations. And we did hear that too, that's kind of where we're really thinking about the dynamic between API who were experiencing feeling like they not only have to, process how they're feeling, but then also kind of like almost cater to their colleagues who are wanting to support or feeling like bad about what's happening, and kind of some of the struggles that brought on too, that a lot of times AAPI feeling like they had to educate their colleagues, like this is what's happening, and like I'm sorry that you feel bad about it. And so just the tough situation we were in, having to kind of balance both. Also highly utilizing one-on-one time with supervisors to have that space for support and validation. So that's really great to have a supervisor that can kind of understand the experience, or at least offer that support to you. Thank you, Jessica. Also resonating with the feeling of not being asked or checked in on after the shooting. And then Christina again saying that I didn't know how compacted my experiences were until I was given this space to explore. So that is great that, and I don't know, Christina, if you could share a little bit more, because I know we could just use the chat, but maybe just how your supervisor was able to kind of create that space for you and make you feel comfortable to be able to talk about how you were feeling. Great, thank you everyone for sharing. We'll move us into some of the themes that we heard from the listening session, but continue to welcome your comments and thoughts in the chat. Go ahead, Rochelle.
Oh, sorry. So as we mentioned earlier, we've been doing many of these listening sessions across the country, and these are some of the themes that we've heard as we've gone along. So really that fear for safety was something that came up consistently, whether it was a new fear that you now were participants were expressing, like I've never felt this way before. I've never felt like I had to look at my surroundings in the same way. Or one participant sharing, I had to tell my brother that he now should close the back door to his restaurant because that's not a safe practice. And so kind of that shift in thinking that was occurring for many participants, and especially for the elderly, given that many of the attacks were happening with the elderly. And so, hearing about fear for parents or for grandparents and what they might do. And that kind of that heightened sense of awareness that many participants shared, they hadn't experienced before. And so this was new, and trying to figure out, well, how do I do this? How do I talk to my parents? How do I talk to my kids? How do I make sure they're safe? So those were some experiences that we heard a lot of. We also heard that allyship was really important, as we've been talking about and hearing from you on chats too, is that, having people check in, friends or colleagues, to recognize what's been happening and how it's impacting you was really important. And it made participants feel seen and heard, because oftentimes in the AAPI community, there's a sense of feeling like we're invisible, that we're not seen, or often kind of seen as more white rather than experiencing some of the racial injustices that other groups are experiencing as well. And so it was really important for participants to have that heightened sense of awareness from their supervisors or their coworkers, and even going back to understanding what some of the historical events have been for the AAPI community that have kind of led us to why we are here now, and noting that, as early as the Chinese Exclusion Act and events during World War II, and with other experiences that continue to have Asian Pacific Islanders feel like this invisible minority in the country. And so now that there's a lot of media focused on it, and May last month was Asian American Pacific Islander Heritage Month. So there was a lot of focus and, education that was going on, more listening sessions. And what we heard was this: it's important for us to continue to be visible in the space, and to share more knowledge, to educate our colleagues on what has been happening. So those are some of those themes that we saw from the listening sessions. And if anyone else has experienced a listening session or would like to share maybe something that you took away from it, we welcome you to share that as well. And Christina provided more detail on her experience with her supervisor, who also identifies as AAPI. And again, just thank you for sharing your experience of how powerful it is just to connect with somebody else who identifies similarly and maybe has had some similar experiences, can really help to support and give you space to explore and to connect and to think about how to move forward too, as well. So we'll move on to the next slide, I think. And so some of the things to think about, Annie talked about this a little bit earlier around kind of looking at who is in your organization and who is overrepresented or who is underrepresented, what are the different identities that people come with. And so this can help you think about what listening sessions might look like in your own workspace. As a follow-up to, we held 2 very general listening sessions. And then, as I mentioned earlier, we had a couple organizations reach out to our center to offer some more. And when we were offering things more to specific organizations, we recognized that kind of thinking about relationships between providers and supervisors was important. And people really indicated that it would be helpful to not be in the same space as their supervisor so that they could come up in a way that was really more authentic and they could feel more comfortable kind of sharing in that safe space and not worry if there would be any kind of repercussion. Annie, I didn't know if I was supposed to go on or if you want to jump in. I'm fine with going on, but I wasn't sure if this was part of your slide or not. Should I go on?
Yes, you can go on.
Okay, so one of the other things too was that being an outside facilitator was helpful for organizations so that everyone could really be a participant in the listening sessions. And so we did sometimes try to coordinate with organizations where they might have a supervisor lead a session for another organization. And so when we could, we did try to bring in other facilitators to help us. I think we had maybe a little bit over 100 people in our first listening session. And so we did engage. We tried to make sure our small groups were small enough so that everyone would have opportunity to share. And so we did try to limit our small group breakouts to about 10, 12 people max per session. And so that's why we would work with different facilitators often from other AAPI serving organizations to help serve in that role. We also wanted to make sure that we were always acknowledging our own biases and privileges and giving space both to participants as well as to ourselves, right? I mean, it's hard because Annie and I both identify as Asian American. And so, you know, as we're going into this space, I can tell you, I think I was doing healing circles every week for the last 2 months almost. And I think that as you go into these, and if you are going to think about facilitating or hosting them, to make sure wellness is even more important, right? Like really making sure that you are giving yourself your own space to connect outside of these circles as well. And there is so much power in sharing what you're experiencing also. And so, as you might be thinking also about exploring these kinds of listening sessions for your workspace, I think asking to find out, would this be useful? Would you show up? Do you have enough people who are interested and would find it valuable to have this kind of space to check in on each other and to do it during a time where people can feel like they can show up? One of the things that we heard was, doing it towards the end of the day was a little bit helpful, because the idea of then going back and doing clinical work after just having had a really heavy discussion was a little tough. And so we tended to hold our listening sessions towards, 4 o'clock in the afternoon, when people could be winding down and could participate and then go on with their day. So those were some of the things to be thinking about. And Annie, are there other things that you would offer for people to consider?
I think one thing you said, Rochelle, about checking in to see if it would be helpful is important, because I think what we noticed too with some of the kind of community sessions was that right after, the shooting, there was so much interest and a lot of people kind of asking for these type of spaces. And then over time, maybe people were, there was not as much of an interest. So actually it became harder to get, participants to join. And so just really being able to kind of respond to what like the need is, so that you can put these together in a way that's most, helpful for, the colleagues and the community.
Yeah. And it's amazing, because I think I was just sharing this morning, I did a listening session, and it was the first time this group had done one. And it was interesting to note that those feelings of fear and anxiety are still there. I mean, they are still being experienced. We're still seeing, I think, Annie, you were mentioning to me that was it March or April that still had the highest rate of attacks on Asians that had been reported. So every time you see that in the news or hear about it, or hear about a friend or a colleague who's experienced something, it raises up emotions and feelings that are important to have space to explore. Okay, well, I think are we moving into Q&A now, Annie?
Yes.
Okay. So we've invited you to share questions, and if you've shared them directly with Terrell, that's great. Or if you want to post them in the chat, we're happy to respond to any questions or comments that you have. So there is a question about whether your organization does other affinity groups. I will share that on our other, so we partner on several technical assistance and training centers. And on one of the ones that is focused on children, youth, and family, the mental health of children, youth, and families, they've been doing affinity groups for the African-American population of providers. And we did hear back from other, when we did our first session and had quite a few allies on the group, there were people that were saying, can you do this for other affinity groups? Because it's so needed, right? And so that's something that we're exploring, and our center has different mechanisms for doing that. So we really feel like this is a model that works well for any group, really, because it is about providing space and connection and an opportunity to feel heard and seen by colleagues. Oh.
So Terrell, it sounds like does your organization offer affinity?
Okay. Sorry. And yes, we do. So Change Matrix has been contracted with other organizations to do this as well, both in kind of the private sector as well as for behavioral health organizations too. And because I co-direct a center that offers professional development opportunities for organizations in the California, Nevada, Arizona, Hawaii, and Pacific Islands area, the MHTTC, sometimes we can bucket that under our work. Thanks for the question, Terrell.
I'll just jump in and add that Change Matrix has also been supporting communities with healing circles. So actually when Rochelle and I were talking about listening sessions versus healing circles, and we've just been hearing so many things from AAPI, but kind of in both spaces, that we were just talking about even what the difference was. And so that listening sessions that we were doing for like AAPI providers and with more of the context around like the workplace, that those tended to be more an opportunity to talk and learn and listen from each other. Sometimes people would talk about like strategies around how to kind of address the issue, versus the healing circles were much more emotional. It really was a space for community and validating each other's experiences in a time of grief. And so part of the work around the healing circles was that we did actually have more specific kind of groups that we worked with. So like offering space for adoptees that are Asian who were kind of struggling with where did they fit in kind of with what was happening, like LGBTQ, AAPI, and then we even had a space for Asian American men, because what we were seeing is oftentimes who was coming to the sessions were more people that identified with being women. So kind of offering a space where they can also then, you know, have conversations that maybe they could relate to more. So.
Mm-hmm. And I will share that there are definite, gender differences and similarities in terms of how they process grief and connect in different ways. And so it was a really powerful group. I only know because my partner helped to facilitate them, but it was, we really also made sure that we looked for facilitators who bring that lived experience too, to help with connecting with participants. And yeah, I see another question, so that we'll just go to that from Christina around, can we talk about how the separating of the group of allies and those who identified as AAPI, and what were some of the pros and cons? So what I'll share first is that the first time we opened this up, we thought, we marketed the opportunity through the TA Center to Asian American Pacific Islander providers. And what we found was that many people who showed up were registered. We were noticing as we were looking at the list, like just based on name, and I know that's not always the way to do it, but just based on name, we're like, it looks like there's a lot of allies who are joining, or people who are not identifying as AAPI. And so we had to do a lot of back-end planning around, as Annie was saying, to create a space that centered the AAPI experience. We had to make sure we had a certain number of AAPI identifying providers in a breakout room with allies, so that the conversation could be really centered. So it did take a lot of logistical work to do that, and figuring it out on Zoom too, while creating breakout rooms was a bit challenging. And then the experience was such that for some of the groups, unfortunately, what happened was that ally voice became more dominant in the experience. And so not everyone felt comfortable sharing their experience as an AAPI provider, or what they were experiencing in the community. And so then moving forward, that was where we decided to offer space for allies to join, where they could hear initially some of the experiences, but then to go into their own group to talk about, what does it mean to be an ally? When have you held power and or voice, and how did you use it? So some reflective questions on how to be an ally to colleagues and providers that were experiencing this trauma. And there are definite pros and cons to both, because, when you're separating the groups, then the allies didn't have the experience of really hearing and listening about some of the more deeper sharing that might have happened in small group. And yet our intention was really to help preserve the space for the AAPI experience, and to not re-traumatize by maybe a comment that might be said that didn't validate an experience or something like that. And so this last one that I was on, did have the live streaming for allies, which is a different model. And I'll be curious to hear to get some feedback on how that ended up working. But I don't know, Annie, would you add anything else to that?
I would just add that we did have like a planning team for each of the sessions. We would do kind of like a planning session together before the actual, event. And there were allies who it was nice to get their opinion. You know, they were really supportive of setting it up this way and making sure it wasn't dominated by like the ally voice. And so it helped us feel like, okay, people would, you know, understand and want to support kind of the way we were structuring the groups. So with that one, I think, because what Rochelle's saying, initially we didn't know what to expect, and we had not asked those questions in registration. We did ask like individuals to just like rename themselves to identify if they were an ally. And I do remember, you know, one of the sessions being in that exact situation where, you know, there was just allies who just really wanted to share what they were seeing. And I think it also goes back to, you know, Christina, what you're saying about like even bringing up microaggressions. And I think part of just the API kind of culture and how API are in workplaces is like, we don't want to take up a lot of space. And so we tend to, you know, question like, yeah, is this really a thing worth bringing up? Or, and so in the session that I was in, I do remember the ally just kind of took over the conversation and was really what we're trying to avoid. And I think it's then some of the API, you know, providers that were in that group were just kind of agreeing with what the ally was saying and kind of letting the ally share. So I do think the main con is that, you know, allies might not get to hear the direct experience, but that these listening sessions weren't always like meant for just that. You know, it really was a space to support API colleagues, and that like other kind of sessions could be set up in a way that's more of like a learning opportunity for allies.
Yeah, thanks for sharing that, Annie. I will share too that that really helping to prep our facilitators was important. We tended to go in groups of 2 just because I always like doing things in teams. And so each small group had a facilitator and a co-host to help with creating the space. And I think one of our lessons learned too was like kind of what direction to give to some of the people that we had jump in, which was amazing. Some providers jumped into this facilitation role in like less than a day, you know, like they're like, yes, count me in. And it just goes to show too, how people really wanted to step up and to provide this opportunity and space for colleagues. Just because somebody is a therapist doesn't always mean that they are a facilitator, right? And so there are some skill sets around facilitation that I think are really important, and things that we tried to provide to our facilitators as well, who served in that role, for like how to redirect, what to do if, you know, we had a similar rule that is here for this conference. If somebody says things that aren't in line with the agreements that we had set forth, that they would be immediately removed from the small breakout room. And so I think setting up, you know, preparing for those events is important. And fortunately, we didn't have to do that in terms of removing any participants. Any other questions or thoughts or reflections that you would like to share? Terrell is sharing, holding the space for courageous conversations. Yeah. And then thinking about how you hold a different space for healing. Yeah, those distinctions are nice. They're they're nuanced and important, right? To think about the well-being of team members in space and in the workplace. One concept I'll just share, but feel free to enter anything into the chat. A concept that was shared with us around the healing circles that we found really powerful was a concept called weaving. And so this is kind of another one of those distinctions between listening sessions and healing circles, was that in the healing circle, I mean, in normal times, right, it is an actual physical circle and people take turns and you go in the circle to share. In the virtual space, what we did was the same thing, and we asked people to before they shared what they were experiencing, to think about something that the person before them shared, how they might have connected with them, or something that might have been meaningful to them, and to weave that into their response. So in a way, it's kind of a way to validate what somebody said before you, to make them feel heard and seen. And then you go on into sharing what you want to share during your time. And that concept of weaving, I think, was really powerful for small groups, because I think we would get feedback that they felt, that people really felt connected, and there were connections that were made that probably continued after the healing circle, because of that way that you could connect your experience with somebody else's.
Yeah, so in addition to what Rochelle's saying, is we did hear people say things like, we have this great conversation. I feel like I connected with someone, and then you just go on, like, oh, I heard someone say this great thing. And so we did start encouraging people to message each other privately, to exchange contact information, so that what Rochelle's saying, like the relationship could, continue on after kind of these sessions together. So I know that would look differently for a session with just your coworkers who you would continue to see, but that's just, if you were to ever join, I guess, like a listening session more for kind of the region or the county, that there's a lot of opportunities to connect, and still learn from each other, and have that support system after. So I'll share, I was on a healing circle for Asian mothers, and what we talked about was, just how this impacts us as mothers, and we think about, raising our kids and having Asian children, in school, and these impacts on them. And so many of us have kept in touch actually after that session, so that we can continue to support each other.
Yeah, thanks for sharing that, Annie.
Mm-hmm. Great, thanks, Terrell. So Terrell just put in the chat the feedback, survey feedback, if you could please take a few minutes to complete that survey.
And there's also a comment from Ahmad around starting a group in Fresno a couple of weeks ago, and the time it took to plan it, and that you're really finding it useful for your team. So that's great. Thank you. I mean, I think the point too is that, it's never too late to start. I know you're saying that it took a while to plan, and it just happened recently. And I had the same experience where I'd been planning with a group for a couple months, and they just had their first one this morning. And so I think don't underestimate the power of just doing one, right? Like just creating the space, even though, if it might feel like it takes a while to get it going, that just taking that first step is powerful for team members to know that they are going to have something that they're seen and heard, and it's important for well-being of the staff. So Christina asked a question about using weaving in listening sessions that are generally for people of color for the purpose of solidarity. And I think that'd be great. Our listening sessions were just so large. We could do that in the smaller group breakout rooms, but I like that concept. I think it works. It's so powerful. And you can see after somebody shared, sometimes there would be a pause, but it's like, people are leaning in to see like, oh, what did I say that somebody's going to connect with? Like, how am I going to feel validated? It's a super powerful way. And so I think sharing that in a lot of different spaces, like it just doesn't even have to be in healing circles, but just recognizing that when you take the time to listen and to hear really, and then to connect off of what somebody shared is so meaningful. And so I think if it can be used in listening sessions, we'll try. Oftentimes it's a matter of like, how do you ensure that everyone has the space and the time to share? But I like that idea, Christina. So I think we're coming up towards the end of our time. Terrell, are there other things that we need to do in order to close out our session?
Well, just want to say thank you, everyone, for your participation. And again, there is a survey in the link. I said, everyone, please complete the survey so we can continue to bring these resources. Thank you all. Have a wonderful day.
Thank you.
Thank you.
Thank you, Christina.